Okay. So, Dr. Aksar, your time starts now. Dr. Aksar, are you there? I'm holding the timer again. Let me know if you are available right now.
Yes, ma'am. Am I audible? Hello,
Yeah, Dr. Aksar,
ma'am.
can you
Are
hear me?
available?
Yeah. Sure. So your time starts now.
Yes, ma'am.
Hello, Dr. Aksar, I guess you have some connection issues. You're not audible to me. Hello? Can you please join again? Okay, let's wait for her first. After this, who is available to do after Dr. Aksar? Dr.
Hello,
Farheen?
ma'am. Am I audible?
Yeah, now you are audible.
Okay,
So
okay.
after
Sorry,
Dr.
ma'am.
Aksar,
There's a
Dr.
connection
Farheen,
problem.
please get ready. It's okay, no worries. Am I audible now so we can start?
Yes, ma'am. You are audible now.
Your time starts now.
Okay. Hello.
Hello?
My name is Dr. Raksa. I'm one of your attending physician here. Can you confirm your name and age, please?
Yes, doctor, I'm Mr. Faisal, 38 years old.
So, Mr. Faisal, what brings you here today?
Doctor, I've been seeing some bright red blood when I go to toilet, and I'm really worried about it.
Hmm. So, Mr. Faisal, when did you notice it first?
Doctor, it's been going on like for 3 months off and on, and I was ignoring it at first, but now it's making me very anxious.
Okay. So, is it a fresh blood?
Yes, doctor.
Sometimes it is it mixed with the stools or not?
No, doctor.
Can you describe the color of your blood?
Yeah, it's bright red, and occasionally when it's I wipe with the toilet paper, I see it on the paper.
Okay. And then how much amount of blood you notice?
Doctor, I don't know, but sometimes it's dripping also.
Okay. So do you have any particular idea about your this condition?
No, doctor.
Okay. And anything worrying about this?
Doctor, I don't know, but I'm really scared. Might be something serious.
Okay. So, Minister Faisal, what were you hoping today from me?
Doctor, I'm hoping that you can tell me if this is serious and there's something like cream you can advise me.
Okay. And how much it is affecting your daily activities?
Yes, doctor, I actually work as an accountant, and it's
Okay.
affecting me a lot because I'm all the time in pain somehow.
Okay. So, Mr. Faisal, in order to diagnose, I would like to ask few more questions. So, is it associated with any tummy pain?
No, doctor.
Do you notice any feverish?
No, doctor.
How about your bowels usually? Bowel habits?
Doctor, they are sometimes I feel slightly constipated and I pass a stool every 2 to 3 days. Sometimes it's very hard and I have to strain a lot.
Okay, and did you take anything for your constipation?
No, doctor.
Do you notice any weight loss along with this?
No, doctor.
Do you notice any something coming out from your back passage?
No, doctor.
And is it associated with some pain, especially at your back passage?
Yes, doctor, doctor, I feel some anal discomfort and itching, and yes, I feel something is coming down occasionally after straining, not daily.
Okay. So, do you ever feel any rashes,
No, doctor,
any joint pains,
no,
or sometimes is it associated with the mucus?
no, doctor,
So, have you ever suffering from similar type of illness in the past?
no, doctor, since 3 months, even though I have this hectic job, I have to sit all the day, and it's almost 12 hours a day. Before this, I was completely fine.
Any other medical problem you have?
I have this high blood pressures.
And what do you take for your high blood pressure?
I take amlodipine 5 milligrams once a day.
Okay. Do you take any other medications?
No, doctor.
Any blood thinners or painkillers?
No, doctor.
Is there any family history of similar illness?
No, doctor.
Any family history of your blood cancer?
No, doctor.
Do you smoke, Mr. Passer?
No, doctor.
What about your drinking habits?
I don't drink alcohol.
Okay, and how much and how often?
Doctor, I don't. I
Oh,
occasionally do
okay, okay.
sometimes, but regularly I'm not taking anything.
Okay, and what about your diet? What you take usually in your diet?
I'm taking like a low fiber diet. I know I have to take a lot of fibers and vegetables, but I don't have any time.
Okay, do you take enough amount of water or
Sometimes I take,
you
but I'm taking these fizzy drinks mostly because I just need to stay active all the time.
okay, and what about caffeine?
No, doctor. Not a lot. Only one cup a day.
Okay, Mr. Faisal, you said to me that you experienced some fresh blood coming out from your back passage. That since you have noticed from the last evening, and sometimes it is associated. You usually constipated, and sometimes trading. Am I right? Or would you like to add something?
No, that's all, doctor.
Okay, I would like to examine you. Can you able to sit on the couch, please? And I'm going to sanitize my hand.
Okay,
I
doctor.
will start. I will start from your gender vital. I'm taking your blood pressure and notice if any temperature and pulse also, and also the BMI. And I will call the chaperone in order to maintain your privacy. I will look. Can you take out your shirt, please?
Okay, doctor.
Okay, I will going to inspect of your abdomen. So then I'm going to palpate you in order to during palpation. If you feel any pain, you can tell me. Okay, let me know, please. I'm going to palpate, looking starting from the general physical examination. Look into your eyes and the lumps and bumps, and also the joints into the neck, and also in the abdomen for the superficial palpation. Then deep palpation, going to check the any masses and lumps and bumps in the abdomen, then going for the DRA. So is it okay to, I'm going to check your back passage, Mr. Faisal?
Sure, doctor.
Okay, I'm going to inspect for any visible masses or mucosa or any unhygienic conditions or any mass. Then I'm going to
Mm.
palpate from the inside to look into the your inside lining or feel anything else. So is there any finding?
Okay, so the abdomen is soft, non-tender, no masses, no organomegaly. On PRX, small external bulging, some skin tags, no thrombosis, no fissure. DRE, no mass, normal sphincter tone, soft stool, minimal internal hemorrhoids palpable.
Okay. Then I'm going to also, Mr. Faisal, I'm going to advise if you more investigation. Would you do it for me?
Sure, doctor.
In order to see that it is Mr. Faisal, from after the examining you and after the data that I gathered from you, I'm suspecting you that you have a condition which is called hemorrhoid. Do you know about this?
No, doctor. 2 minutes remaining.
Okay, the hemorrhoid is a thing that is the something the internal gut lining is coming out from because of your constipation and it's swimming, and it is because of the repeated pressure it is coming out, and sometimes it is painless, and sometimes it is no harm can cause you. But if it will be create pain, or it will be create some change in the color, or not going inside, even by your manual reduction, then you have to go to the hospital. Meanwhile, I'm going to give you some offer some investigations like blood CBC and urea cut, and also the I'm going to advise some of the lifestyle management that you have to take this stool softener because of this, and also I'm also advised a stool DRE, stool detail report also, and fecal of blood, and in the meanwhile, I'm going to advise it take the more amount of fluid, take the fibrous side, and avoid the constipation, and also avoid I'm going to change your tablet, which as you are taking amlodipine, sometimes it might be causing the constipation in order to get. I'm suspecting this, so I'm going to change this along with the losartan, 50 milligrams, and meanwhile, you have to take lots of fruits and vegetables also in order to prevent from the constipation and more fibrous diet, and keep your area clean. And if you suspect any more amount of blood, any dizziness, any something that is mass coming out from your back passage, which will become more painful, then you will have to rush out to the ER. And also, I'm going to give you the some of the leaflets about your this condition, so you can go and have a read about it. And if you have inquiry, you can come back after two. You can come back anytime. But I'm going to give you a follow up after the 2 weeks. Then you can
Time's
discuss
up.
anything else about yourself.
Okay. Dr. Aksa, did you give any medical management? Any topicals?
Yes, no manner. Right now, I'm not giving the topical. I
Okay.
was
Okay, can in 30 seconds, please tell me about the pharma management of this. Okay.
okay. If you have experienced some pain, then I'm going to prescribe some lidocaine gel for your topical application for prevention of your pain. And also, there I'm going to prescribe some of the nitrate GTN 5% 2 times per day to around your back passage for the easy smooth passing your stool. And if it would be applied before you feel that you are going to the washroom, or any passing urgency to pass any stool, so before you have to
Okay,
apply this.
time's up.
But sometimes you experience headache with this GTNs.
Okay. Okay. Nice try, Dr. Aksa. And did you do this case first time with me or first time here?
Yes, ma'am. First time with you, ma'am.
Okay. Please, everyone, we are colleagues and don't call me ma'am. It feels awkward. And
Okay.
Dr. Aksa, actually, your way of approach was different. That's why I asked you. Like you first
Hmm.
asked the eyes in the beginning, right? So this is
Yes, ma'am.
another approach. It's acceptable also, but what's more like what the eyes is mostly asked in the beginning when it's an emergency case. Okay.
Hmm.
So when you see there, it's not an emergency or it's a stable
Hmm.
patient, you can just finish everything like past medical, family history, drug history, and after all of that, you can ask about idea, concern, and the expectations. Because if you
Hmm.
start in the beginning, for suppose if they ask you for the creams and you were telling the lifestyle, you somehow for everyone, we somehow forget about the concerns and expectations till we reach the end of the history, right? So for that,
Hmm.
when the patient is stable and there's no emergency, we can put the ice at the end for our convenience and for a better case approach. Okay.
Okay.
So this was,
Okay.
yes, this was a hemorrhoid case and it was not strangulated, neither is infected that we have not to send this patient to the emergency. So in this case, the patients said the idea he doesn't have any idea, but he was concerned about something scary. So we have to reassure in a way, like even though you see bleeding. from down below, but it's not something serious. It's mostly because of the constipation and your long sitting and your low fiber and less fluid intake on the daily basis. And it is manageable with some lifestyle changes and some medications. So you told about the lifestyle first. His BMI was normal, which I didn't tell you, but in general, if the BMI is high, we can advise for the lifestyle, like 30 minutes walk or exercise, or just park the car away from your office so you can just walk like 5 to 10 minutes till you reach your office. Okay. This patient only had high blood pressures and he was taking amlodipine, no drug allergies, non-smoker, no alcohol, nothing else. Um, did you go for investigation? On investigation, if there is anemia on general physical, then we will advise about the CBC. But if the patient is even when he's not anemic and he's telling you about weight loss or shortness of breath, then still we have to go for routine CBC and ferritin if it's prolonged. So he is having since 3 months. Um, we are not sure how much, so CBC should be done to rule out if for any anemia. No need for urgent colonoscopy in the absence of the red flags. So here the red flags were weight loss, abdominal pain, mucus, diarrhea, nocturnal symptoms. These are the red flags in this case, and the family history of the colorectal cancer and previous colonoscopy. Okay. Only urgent colonoscopy is considered, like flexible sigmoidoscopy, if persistent symptoms are there, like age more than 40, with change in the bowel habits or with the other red flags. And sometimes and the diagnosis is not certain, only then it should be for flexible sigmoidoscopy. In this management plan, we have to just clearly explain what is going on, reassure that based on this history and examination, this is most likely hemorrhoids related to the constipation. And it's not the infection of the lining, it is basically the bulging out of the intestinal mucosa, or you can say the part of your bowel outside just because of long straining and your lifestyle, especially diet and uh, fluid intake. Explain that piles or these hemorrhoids are swollen veins around the back passage that can bleed when strained. Acknowledge his fear of cancer, if any, but he wasn't having any. He was telling you that something may be serious. So tell him it's not anything serious. Okay. Bright, acknowledge his fear of cancer and explain why the features here are reassuring, that the bright red blood on the paper and there are no weight loss, nothing else like that. That's why it's nothing like cancer that you are thinking. Conservative management like increased dietary fiber, adequate fluids, stool softeners, or bulk forming laxative. We will say Espagula husk, and we will advise 1.5 to 2 liters of daily fluids and avoid frizzy drinks or any sugary drinks. Avoid straining for long. Tell him that only go to toilet when you feel like you're an urgency, and only sit for 3 minutes if it's possible for you. Like, don't prolong your time for toilet more than 3 minutes. Regular exercise and weight optimization. Medical treatment is just two things. If it's painful, you have to give a topical local anesthesia with the corticosteroid suppository or an ointment, okay, for short-term relief. I'll tell you exactly what we can offer in this patient. Okay. Otherwise, sometimes if the pain is too much, then we can give simple oral analgesia also for discomfort. When to refer if there is persistent bleeding, if there is prolapse and pain with the thrombosis, then refer. And if there is any new red flag or the family history of colonic cancer. Safety netting, you will tell the bleeding becomes heavier or continuous, then we have to present and arrange a follow-up in 4 to 6 weeks. Okay. So,
Dr. Musarat, can I ask a question? Assalamu alaikum.
Walaikum Assalam. Yes, Dr. Ashma.
Dr. Musarat, as this patient was complaining of fresh blood, so no need of occurred blood. Am I right?
Yeah, here there's no need of occult blood. It's only CBC that I told. And if there is any red
Yeah.
flags, then we will go for flexible colonoscopy or sigmoidoscopy. Okay?
So only CBC is enough for this
Yeah,
patient, na?
CBC. Even when the patient is not anemic, then CBC is also not required, but still it's going on for 3 months. We need to check
Mm-hmm.
the HB status of the patient.
And Dr. Musarat, and one more thing, like in non-pharmacological treatment, we can also offer sitz bath.
And hemorrhoids will,
E-
yeah, we can offer stitch bath, but this is basically mostly for
for
anal
anal fissure.
fissures. Yeah, for the
Yeah.
healing. But this is veins,
And
so we have to just stop what's bothering it.
okay, and there is one tablet. I'm not not memorizing this at the time. There is one tablet for hemorrhoids, but I think that is that
Teflon.
a specialist.
Teflon.
Deflon, yes, 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 yes. You are right. Deflon. Can
Definitely.
we
Okay.
prescribe that? Can we prescribe that as a
If the
GP?
patient, as a GP, I don't think so because first we also have to go for lifestyle and weight management
Mm-hmm.
and the topical anesthesia, things like that first. But when it goes to
Okay.
third and the fourth degree hemorrhage, then this is definitely referral. So we need to check out if
Because
we can
I
prescribe Deflon or not.
And
because
you,
at first degree a doctor prescribed a patient came to me and he was on Daflon and he improved with these medications. So I this was my question, that as a GP can we prescribe these medication or not?
doctor,
We
in
need to check about Deflon.
in UAE here in CMEs and all these, they were telling us that
Mm-hmm.
the GP has to prescribe Deflon just to make the
Mm-hmm.
patient prepare when they will go for proctoscopy. Just for this reason, they told us that
Okay.
Otherwise
nowadays, yes,
not.
yes, otherwise not. Just
Other
in, yeah, nowadays they are telling us
Okay.
like this. Dr. Musarat, I
I
have
guess
one
it's,
question.
So for this
yeah,
patient, only non-pharmacological only. We will not give him any medicine.
topical
Only creams.
anesthesia.
Dr. Musarat, I
Oh
have one
yeah.
question.
Anesthesia, if he had the pain, yeah, but
Yeah,
without
if
pain,
he
will not.
has a pain,
Mm-hmm.
not without pain.
Okay.
Dr. Musarat, there is one condition, but I don't remember, in which we tell the patient for ice packs from below. Do you know what is that condition? If it is in hemorrhoids or what? I don't remember exactly. If you can help us.
Ice packs from down below, it sits bath in the anal fissure as far as I remember.
I
So
think so.
sits
Yes.
bath, it is hot water. Yeah, it is not the
Yeah,
but there is one condition in which we use the ice pack also. Maybe when it is
I'm
thrombosed
not
If
sure.
those
or
numbers
infection
after
For
getting
or
thrombosis, for
Yes,
refer, I
when
think.
it is a
yes,
thrombosed, yes, then we have to give ice packs. Yes,
in,
you're right.
in
but we
thrombose,
But
yeah.
have
it
to
depends on the
remember
grade.
that
It's
Hmm?
yes, in thrombose within 72 hours we have to admit the
Yeah,
patient,
mission.
and after 72 hours when the patient is
yes.
stable, then the ongoing treatment involves ice packing.
Mm-hmm.
Okay, thrombose.
Okay. So next doctor, Doctor Nahla.
Yeah. Okay. I'm ready.
Okay, Doctor Nahla was saying okay, then Doctor Fareen after that you can do.
Okay.
Doctor Amin says there also. So your patient, let me bring the case for you. Miss Sarah, 29 years old, presents with her problem. Please proceed with history and management plan. Examination is great. Okay.
Examination. What? Sorry.
Examination is great. If you want to do, you can do.
Oh,
If
okay,
you
okay.
don't want to do, it's up to you. Okay?
This Miss. Okay. Okay.
Your time is up now.
Okay. Hello, Miss Sarah. I'm Dr. Nahla. How can I help you today?
Doctor, I get this horrible sharp pain every time I open my bowels.
Mm-hmm. Can you tell me more about this pain?
Yes, doctor, it's been the 4 weeks like it's going on. I've been passing like broken glass every time I go. I feel like something is cutting me down there.
Something, sorry, what?
Something is cutting me. It feels
Oh,
like I'm
okay.
getting cuts down here.
Okay.
Yeah.
Okay. I'm so sorry about what you are feeling. It must be difficult for you. So could you mean that it's like a sharp pain from down below, from
Yes,
bathroom?
doctor, very sure.
Okay.
Yeah.
Okay. Do you notice that anything make this pain more for you?
Whenever I go to toilet, every time, now I'm
Mm-hmm.
scared of going to toilet. Doctor, it's
Mm-hmm.
really bothering me.
Okay. I understand. So do you notice anything make it less?
After 1 to 2 hours of opening my bowels, I feel better.
Mm-hmm. Mm-hmm. Okay. Do you notice any blood coming with when you are passing stool?
Yes, doctor. A very little, but it's bright red blood
Mm-hmm.
after I pass. Yeah.
Mm-hmm. Do you notice that you have hard stool?
Doctor, recently I was having hard stools and had to strain a lot. Otherwise, I was fine.
Mm-hmm. Mm-hmm. I'm so sorry. You told me this symptom since when? How
4 weeks.
4 weeks. Do you notice any weight loss?
No, doctor.
Mm-hmm. Okay. So, Mr. Sarah, do you take any medicine for regular base?
No, doctor.
Any medicine recently? Are you hearing me? Hello?
We can hear you, but I think Dr. Musarrat's connection
Oh,
has some problem.
okay. 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 So, Mrs. Sarah, if I give you scale from 1 to 10, while the 10 is the maximum pain, how can you scale your pain?
Doctor, it's 7 to 8.
Mm-hmm. Oh, so severe pain. I'm so sorry about what you're going through, Mrs. Sarah. So, you told me you have hard stool. Am I right?
Yes, doctor.
Okay. So, um, do you use any medicine for regular base?
No, doctor, but I took this some paracetamol, but it didn't heal me a lot.
Okay. So, Mrs. Sarah, do you have any gut problem before?
No, doctor.
And this first time you have this problem?
Yes, doctor.
Okay. Mrs. Sarah, may I know when your last period?
2 weeks ago.
Okay. So, in your family, there is any gut problem?
No, doctor.
Okay. So, Mrs. Sarah, what do you do for living?
Doctor, I'm teacher.
Okay. And with whom you are living?
I live with my husband and one kid.
Um, and could you please tell me about your typical diet?
Yes, doctor, I try to take uh, a normal diet, but sometimes I just take junk foods.
Okay. Are you drink like more fluid?
Only 3 to 4 glasses a day. Mostly I'm taking coffee.
Okay. So I'm so sorry, Mrs. Sarah. Do you notice any lump from the back passage?
No, doctor.
Okay. So, Mrs. Sarah, what do you think might causing this pain for you?
Doctor, maybe I don't know, but maybe this hard stool have caused me some pain down below.
Okay. And what worries you the most?
Doctor, I'm scared of going to toilet now. Like I'm not even eating regularly these days. Maybe
Yeah.
something serious. I need surgery.
I understand. I understand. So, in which way I can help you today?
Doctor, I want something to stop this pain quickly. I'm hoping that some cream or any medication.
Okay. And other that this affecting you and you're afraid to go to the bathroom, is there any effect else?
Yes, doctor, I actually work as a teacher, so I have to take care of kids at the school and, taking it's making my job difficult. I'm all the time in pain.
I understand. So, Mrs. Sarah, you came today because you have a pain from back passage and you think might be like a serious problem and you need from me to give you medicine for that. Is that all?
Yes, doctor.
Okay. Mrs. Sarah, may I check you?
Sure, doctor.
So I will check your vital temperature and blood pressure, and I will check your eye, and I need to check your tummy. I will touch it lightly and deeply, and I will check you from back passage. Okay.
Okay.
Okay. So.
On gentle separation, the small linear tear on the posterior midline of the anal verge, very tender to touch, and diarrhea too painful that you cannot attempt it.
Okay. So, Mrs. Sarah, from your talking and after I'm checking you out, I think you have a condition called anal fissure. Do you have any idea about it?
No, doctor, what is this?
This is like a small tear in the lining of your back passage in anus, causing this pain, especially when you have like a hard stool. It will be so painful. And you are right that a hard stool can cause this problem for you. Am I clear for you?
Yes, doctor, but is it something dangerous? Like I have to go for surgery?
No, no. It actually, I want to reassure you, there's nothing serious to worry about. And with some advice and medicine, hopefully your condition will improve. Is it okay?
Yes, doctor.
So, for because as I told you that hard stool can make this problem more, and now you told me you are afraid to go to the bathroom, so I will give you some advice to manage the hard stool. So how about like increase your fluid and try to eat a high fiber diet. Is that okay with you?
Okay, doctor.
And also, if you use like a warm bath, it
2
will
minutes
help you.
remaining.
Okay. If you use a warm bath, it will help you to relieve this pain and even for healing for this tear. Is that okay with you?
Okay, doctor.
There is some medicine I will give you called GTN ointment.
Mhm.
You can use it twice per day for 2 months. Is that okay with you?
Okay, doctor.
And also for the pain, you can use lidocaine ointment also. Apply it before you going to the bathroom. This will help you so
Mhm.
much and relieve the pain while you are passing the stool. Is that okay?
Yes, doctor.
Okay, I want to see you after 2 months, but at any time, if you feel that your symptom become worsening and severe and you cannot tolerate it, don't hesitate to come to me immediately. Is it okay?
Okay, okay, doctor.
Do you
Doctor,
want?
how to take this sitz bath?
Sorry?
How to take this sitz bath? How often should I take it?
You can take it like 3 times per days, and whenever you
Okay.
make it use it more, it will help you. Okay.
Okay, doctor. All
Do
right.
you want to ask any question?
No, doctor.
Thank you.
Okay. Dr. Nahala, you still have 30 seconds. Do you want to do safety netting?
I Yes, okay. So if you feel that the pain is like not subside or get worsening, or you notice any bulging from back passage, you can come to me immediately. Okay.
Okay, doctor. Okay, doctor. Thank you.
Welcome.
Time's up. Yeah, so it was anal fissure. Patient was having so much pain, and usually we see the anal fissure patients mostly present to us after weeks and weeks. They try to manage it at home, but sometimes people present to us earlier. But in this case, always we have to tell the fibers and the fluids and to avoid the constipation. She was having the recently constipation, so we will advise the bulb forming like a spugula husk for this lady and to encourage the regular and unhurried toilet habits. Like sometimes what she was doing, she was how she, constipated she got, she was trying to get hurry out of the toilet. Okay, and tell her not to delay the defecation. That's one of the cause because she's a teacher. She delays her defecation. Warm sitz bath, you told, and a warm sitz bath after defecation to reduce the spasm. So this was the important thing that we need to address here. Tell the patient take the sitz bath after every defecation because every time she goes to yeah she will injure herself. So we need to give her symptomatically warm sitz bath at the moment. Okay, and medical management you told perfectly topical local anesthesia gel before the defecation and the GTN if needed, 0.2 to 0.4%. Yeah, did you tell the side effect? Because whenever we are giving the GTN,
Mhm.
sometimes in South Asian countries that they apply so much gel just to get relief from the pain that it causes them a headache and postural drop.
Mm.
So we have to tell that it might cause you headaches. Otherwise, it was perfect. And sometimes simple oral analgesia might help. When to help, you said after 2 months, yeah, it's 6 to 8 weeks of follow-up with this therapy. And when she has multiple fissure, not one, then we have to refer the patient. Fissure is
It,
not healing within 6 to 8 weeks, or if she's having any secondary fissure like off the midline and multiple fissure and associated with any systemic disease, then we have to refer her, like
mm,
Crohn's. And recurrent fissures or significant sphincter spasm. Also, then we have to refer her because then they might give her botulinum toxin injection in secondary care. And safety netting, you told that if it's not improving in few weeks and if she feels change in the bowel habits and weight loss and discharge or like infection and persistent bleeding, then uh,
mm.
come as soon as possible. Yes, so
And
this was the
for
case. Next.
For the warm bath after every defecation? Yeah.
Yeah, yeah,
Okay.
after every defecation. It's
Okay.
15 to 20 minutes. Usually we tell that you have to sit open like your area and you have to sit for 15 to 20 minutes in the warm sitz bath after every defecation. Even if she's going only 2 times a day or 1 times a day, then she have to. But ideally it should be 3 to 4 times a day.
Mhm. Okay.
Next, Dr. Farheen was there. Dr. Farheen,
Yes,
are you available? No.
yes,
Just give me a Okay, so 30 years old Mrs. Fatma came to discuss her problem with you. Please proceed with history. Management plan examination is gray. Your time starts now.
okay. Good morning, Mrs. Fatma. I'm Dr. Fareen. How can I help you today?
Doctor, I'm having this loose stools and vomiting since last 2 days now.
Mrs. Fatma, can you tell me more about it?
Doctor, it's mostly like I'm feeling water is coming out and I have to go like 5 to 6 times a day. And I had vomiting a few times a day also, but now I'm better.
Okay. Okay. So, Mrs. Fatma, I just want to ask you more question about it. Are you comfortable right now?
Yes, doctor.
Okay. So, since you told me that since 2 days you are having diarrhea, right?
Yes, doctor.
Okay. So, can you tell me the consistency of a stool? Is it watery or is it formed stool?
It's doctor watery mostly.
And you told me that it's almost 5 to 6 stool you pass daily.
Yes, doctor.
Okay. And have you noticed any blood in it?
No, doctor.
Okay. And any other associated symptoms like fever?
Doctor, I feel slightly feverish and I have body aches.
Mm-hmm. And how many episodes of vomiting per day?
Doctor, I had a few like 3 to 4 times a day, but now I am better.
Mm-hmm. And Mrs. Fatma, do you have recent history of traveling?
No, doctor.
Okay. And any complaint of abdominal pain?
No, doctor.
Mm-hmm. And did you take any medicine for it?
No, doctor, but I tried many fluid because my friend told me that just take so much water, so I took.
Mm-hmm. And Mrs. Fatma, tell me about your diet. Like, did you take any junk food or any fast food?
No, doctor, I take usually a good diet, balanced diet.
Mm-hmm. And Mrs. Fatma, tell me about your water intake. Did you use are you using boiled water or
Yes, doctor, I'm taking boiled water.
okay? Okay, so Mrs. Fatma, tell me, do you take any recent antibiotics?
No, doctor.
Okay, and okay, so do you have any long-standing illness?
No, doctor.
Are you taking any medicines on a regular basis?
No, doctor.
Okay, and is any member of your family affected with similar illness?
Yes, doctor. My nephew at home, he was having some stomach bug last week. I remember he was having the same condition.
Mm-hmm. And okay, so is he all right now?
Yes, doctor.
Okay, so Mrs. Fatma, tell me about your what do you do?
Doctor, I'm housewife.
Mm-hmm. And do you smoke?
No, doctor.
And do you take alcohol and other recreational drugs?
No, doctor.
Okay. And Mrs. Fatma, tell me about your diet in recently? Like, did you eat from outside?
Sometimes I take, doctor, actually last week we went outside to eat something, but I didn't take a lot. I was eating with my nephew and but he was having the same condition.
Mm-hmm. And okay, and tell me, do you have any history of like intense need to go to the washroom?
Sometimes, yes, doctor.
Okay, so Mrs. Fatma, when did tell me about your last menstrual period?
2 weeks ago.
Okay, and what's your BMI?
Doctor, it's 29.
Mm-hmm. Okay, so Mrs. Fatma, what do you think? What these symptoms are?
Doctor, I feel like maybe I got it from my nephew.
Mm-hmm. And what thing worries you most?
Doctor, I just feel so weak now. I feel dehydrated.
Right, I can understand, Mrs. Fatma. And Mrs. Fatma, tell me about what do you expect from me?
Any medication, doctor? Maybe an
Sure,
Imodium. I heard about this medication.
sure, we will discuss this thing. And how far this thing impact your life, Mrs. Fatma?
Doctor, I'm not doing the things I used to do. Like I have to cook for my family, but I cannot.
Mm-hmm. Okay, sure, Mrs. Fatma, I can understand. Mrs. Fatma, one more question. Just tell me, is your fever documented?
No, doctor. I just feel hot,
Okay,
but it did. I didn't check it on thermometer.
okay. So it is high grade or low grade?
I don't know, doctor. I didn't check it. I just feel myself. I'm feeling more feverish.
Okay. Okay. So, Mrs. Fatma, okay. So, I just want to summarize it that since 2 days you are having these symptoms of having diarrhea since 5 to 6 stools per day, along with that with vomiting, and you are so concerned about your condition as you are feeling so weak. Anything that you would like to add in it?
No, doctor.
Okay. So, Mrs. Fatma, I just want to quickly examine you. Is that okay?
Sure, doctor.
Okay. Uh, in the presence of chaperon and after sanitizing my hand, I start my examination with general physical examination, checking pulse, BP, vitals, and I will check anemia, jaundice, and I will check all the signs of dehydration like dry. I will check mouth, sunken eyes, and I will also check the lymph nodes and edema, and I will do the examination from the back passage also.
Mildly dehydrated, dry mucous membrane, peak blood pressure 170, um, mild diffuse tenderness, no guarding, and soft abdomen,
Temperature.
and afebrile, no temperature.
Okay. So, Mrs. Fatma, after taking history and after examining you, I am suspecting that you have a condition which is called acute diarrhea. Have you ever heard about this?
No, doctor. What is it?
Okay. It is a condition in which you are passing more stools than usual, and there are multiple reasons behind this, like maybe it's due to the infection, and maybe due to the food poisoning, and maybe due to some drugs. Okay, are you getting?
Yes, doctor.
So in your case, I'm suspecting that you are having this diarrhea because you have a history that you took food from the outside. Okay,
Okay, doctor.
so I'm just giving you some of the fluids as you are a little bit weak and dehydrated. So I'm just giving you ispragol husk. You have to take it and increase fluid intake at least 1 to 1.5 liters. Okay, are
Okay,
you
doctor.
getting? And along
Yes,
with that,
doctor.
I am giving you tablet loperamide. You have to take it 4 milligram. Okay. And you can repeat the dose 2 milligram after each stool and maximum till the 16 milligram in a day.
Okay, doctor.
Okay, okay, Mrs. Fatma. And also just increase fluid intake. Try to eat, bananas and rice, apple and applesauce and toast, and increase intake of the yogurt. Can you do it?
Yes, doctor.
If in case you are feeling that more dehydrated, passing more than 8 stools per day and having fever and severe abdominal pain, then you have to go to the emergency department immediately.
Okay, doctor.
Are you getting?
Anything else, doctor?
Anything you want to ask me?
I don't know, doctor. Should I take any precautions?
Mm, yes, you can take any, you can like you have to wash your hands before giving food to anyone else, and just keep your towel separate, okay? And wash your hands properly,
Okay, doctor.
okay? And I'm also giving you 2 sachets of ORS, and after passing every stool, you have to take the ORS, okay?
Okay. Time's up.
Is there anything else you want to ask?
I know, doctor. Okay. Doctor Farheen, why did you prescribe her loperamide?
Um, because of the diarrhea, I think that I should prescribe them.
Okay. For acute diarrhea, she was having
Mm,
6 to 8. So you gave her loperamide. So firstly, we will first tell the patient about her own concerns. Like she was saying that I cannot cook for. You went through all the management, but first thing is she was having from the nephew. She already said I was eating with the nephew. Maybe she took from outside, but it's not food poisoning since she's not having any fever and it's just recent onset in 1 to 2 days. So it's viral gastroenteritis. Okay.
yeah.
And sometimes when the patient is having viral gastroenteritis, there is no antibiotic is needed. So you did all the management plan through uh, symptomatic. That was good. She wasn't having any blood or mucus or any fever, so it's most likely viral gastroenteritis. Or ORS is advised, and mostly after, as you told, in that after every loose stool, she has to take ORS. Simple diet, as tolerated, avoid fatty and spicy foods. We have to like speak these words especially because sometimes when we tell the patient to take a good diet, we usually don't tell them not to avoid fatty and spicy food, and still the patient is taking the spices. And if there is any pain or fever, then we can prescribe paracetamol. Antibiotics here is not needed. Red flag. If the patient is having blood in the stool, high fever, severe pain, reduced urine output. In your history, you also have to ask for how much urine output uh,
Yeah.
they are getting because anuria will be one again bad sign. Okay, and if it's not improving after 5 to 7 days, then we have to like recall the patient again. Otherwise, symptomatic treatment and no follow-up is required in this case, unless and until safety there is any red flag. Okay.
Okay. But if in
As
viral gastroenteritis, can't we prescribe loperamide if the patient is having more diarrhea?
Mostly, we don't give any medication until unless it's required. ORS can be given, and it's not then
Yeah.
symptomatically. Like some patient tell you that I'm going for the meeting or something like that, then only you have to
Yeah.
prescribe. Otherwise, in even in acute diarrhea, you just give symptomatic and you just rehydrate the patient and avoid and spicy and the fatty foods.
Yeah.
Otherwise, occasionally
Actually, I
we
was
don't on the
just
first line
about
we
to say
don't
that
give
it's
dopamine.
viral gastroenteritis.
Yes, it's viral. Okay.
Dr. Musarat, there is some contraindication to loperamide. Can you please tell, like, if patient is feverish or for traveler diarrhea? I think.
If the patient is having, I guess, high grade fever and the patient is too
Mm-hmm.
young, like, less than 18 years, then we don't give loperamide.
Okay,
It
thank you.
is dysentery, like bloody diarrhea, then we don't give Locamet. Like if
Yes,
it is
yes,
having shigellosis. I have a question,
yeah,
Dr. Masarat. Like in this
yeah.
case of acute gastroenteritis, if there is a need to do stool for microscopy culture and sensitivity, when we should do after 5 days if it is not settling to rule out for any bacterial
After
infection.
5 to 7 days, ideally it's 7 days. But if the patient is with fever for prolonged
Mhm.
5 days, even after 5 days, you can do with blood, you can do, and the immunocompromised you can do. Okay.
Mhm. And if there is history of like eating food from outside, and if like you are even if it is like 2 or 3 days, but you are suspecting food poisoning, then
Yeah, you can do, but still, even we do the stool microscopy, we start with the empirical antibiotics. So you don't wait for the stool microscopy to get back. You can offer, but meanwhile you have to tell them empiric antibiotic.
So like how can we decide about it? Like if we say like the patient says he took like some barbecue from outside or he has eaten some canned food, so straight away we start antibiotics.
Yes, for the canned food, we know we will start the antibiotics. Meanwhile, if it is E. coli, Shigella, the dysentery, if it's having blood in the stools,
Mm.
is dysentery, it's MABSs, you start the metronidazole right away. You don't have
Okay.
to wait for the microscopy. And if it's more than 1 to 2 weeks, then it's giardiasis, then it's
Mm.
on the history. We'll be coming to that.
Okay. Thank you.
Okay, so next. Who else wants to do? Dr. Amisa, do you want to
Yes,
do the
can I
case that
present?
anyone?
Can I present the case?
Dr. Dilip? Yeah, sure.
जी जी,
Okay, just give me a minute.
sure sure.
Okay, so your patient, Mr. Hassan, 38 years old male, came to discuss his problem with you. Please proceed with history, management plan. Examination is gray.
Okay, can I
Okay,
start?
1 second. Your time starts now.
Okay, hello, I am Dr. Kumar. I am one of the GPs here. And am I talking to Mr. Hassan?
Yes, doctor.
And please confirm your age.
I'm 38 years old.
Yes, I can see through my notes that you have some concerns to discuss.
Yes, doctor.
Yeah, so please tell me how can I help you today? Mm,
Doctor, actually, I'm having this loose stool since last 4 days now.
mhm. Okay, so are you comfortable talking to me right now?
Yes, doctor.
So please tell me more about this.
Doctor, actually, it's been 4 days, and I was having this loose stool. It
Mm-hmm.
started, yeah, it
Mm-hmm.
started after 1 day of eating chicken from outside.
Mm-hmm. Okay, so how many times this stool is passing out? Mhm.
6 to 8 times, doctor.
And is it what is the consistency?
It's loose, semi-formed,
And does
and
it
sometimes
flush?
watery, doctor.
Okay, so is it easy to flush?
Yes, doctor.
Any mucus in this?
No, doctor.
Any blood?
No, doctor.
Okay, and apart from this, do you have any vomiting,
No, doctor.
any nausea? Do you feel sick?
Yes, doctor, I feel so much nauseous now.
And do you have any abdominal pain?
Yes, doctor. I have this crampy
Eh,
abdominal pain.
And okay, so which part of the pain it is there? Part of the abdomen is there?
It's all in the tummy.
Okay, okay, so how has been your appetite recently?
Doctor, my appetite is reduced.
And how is your water works?
Sorry?
How is your water works?
It's fine.
Okay, and are you able to pass urine?
Yes, doctor.
Okay, and okay, has it happened for the first time?
Yes, doctor.
Okay, so some questions regarding past medical history. Do you have any long-term medical condition like high blood pressure,
Um, no, doctor.
high blood sugar,
No, doctor.
any sort of medication you are taking,
No, doctor.
any drug allergy?
No, doctor.
Okay, so Hassan, yeah, Mr. Hassan, so it has been happening since 1 week. So what do you do for the living?
And doctor, I took some ORS, they said, but I'm still feeling feverish and I still have this diarrhea.
Okay, but and what do you do for the living?
Um, doctor, I'm a businessman.
Okay, so has it affected your routine?
Yes, doctor. I cannot do my work like before, and I have some deadlines to finish.
Okay, I can understand. Um, okay, so any family member has a similar medical similar problem,
No, doctor, but my colleagues that went with me, they had similar problem.
and how they are doing right now?
Uh, I didn't, I don't ask them. Maybe they got some
Mm-hmm.
medication, but
Mm-hmm.
we all are affected now.
Okay, and do you have any recent travel history?
Yes, doctor, 1 week back, we went to
Where?
that trip, and there I
Okay,
ate something from outside. Yeah,
so what you ate exactly?
and this chicken from a roadside restaurant.
Okay, so Mr. Hassan, you mentioned that you have eaten from outside. It is a chicken, and you have been passing stools, and also you have crampy abdominal pain. So, and also you think chicken is the reason for this?
Doctor, maybe
What
I
do you
feel
think?
like, yeah, maybe because it is food poisoning.
And what worries you?
Doctor, I have to go for a meeting in 3 days,
Okay,
so
okay,
maybe I get
and
better.
sure. And what do okay? So, what do you expect from me today?
Any medications or maybe some drips.
Sure. I need to check observations, which include temperature, blood pressure, oxygen saturation. I need to check your skin turgor. I also need to check urine dipstick. I also need to do general physical examination, with a more focus on the abdomen examination. I make sure chaperone is also there, and I sanitize my hands before and after examination.
Okay, doctor. Temperature is 37.6,
Mm-hmm.
pulse 108, mild
Mm-hmm.
dehydrated, soft but mild lower abdominal tenderness, otherwise normal.
Mm-hmm. Okay, Mr. Hassan, based on the information, which I think you have condition, which is called gastroenteritis.
Yes, doctor. What is it?
So, okay, so this is happens when someone eats food from outside. So it is not necessary that all are affected. Some people are affected. Am I clear so far?
Okay, doctor.
So this is a treatable condition. What I'm going to do that I'm going to, as you said you are taking ORS, right?
Yes, doctor.
I'm going to do, going to do some blood test, which include stool DR, blood CBC, C-reactive protein. Also, I need to give you some medicines, which is called ciprofloxacin, 500 milligram BID, and paracetamol, 500 milligram QDS. Is that okay?
Okay, doctor.
Yeah. Do you have any questions so far? Hmm.
Uh, Doctor, for how long I have to take these medications?
Yeah. You have to take for 5 days. For both
Okay,
ciprofloxacin and Panadol, you can take as needed.
okay,
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 and
doctor.
also make sure you stay hydrated, and I shall also prescribe you ORS. You can dissolve one sachet into the 1 liter of the water, and you can drink frequently. Is that okay? Mm, mm.
Okay, doctor.
And eat a normal soft diet, like porridge, like soups, vegetable soup. And if you feel that in between this treatment, if you feel that you are dehydrated, you are feeling dizziness, or you are feeling vomiting, or diarrhea is not responding to the medicine, you can get back to the me or to nearest hospital. Is that okay?
Sure, doctor.
Yeah. So also I'm giving you a leaflet about this condition, in which if you have any further questions regarding your condition, you can call me back or you can come to discuss with me. Am I clear so far?
Okay, doctor. Yes, doctor.
Okay. Okay. So do you have any questions till now?
No, doctor. Doctor,
Okay,
can you
thank
repeat
you.
the antibiotics?
Ciprofloxacin 500 milligram BID after food you can take
Okay,
for 5 days, and paracetamol tablet 500 milligram for 6 hourly as needed.
okay, okay, doctor.
Okay, and also ORS
Yeah.
one sachet 2 times per day for 2 to 3 days.
Okay, doctor.
Okay, thank you.
So,
How much time left?
Doctor, Dr. Dilip, you still have 2 minutes remaining.
2 minutes. What I missed? Okay. Hmm.
Almost you asked everything. Did you ask family history?
Yeah, yeah.
Okay.
I
Uh,
skip personal habits like smoking. I don't.
yes,
I think it was not
psychosocial.
necessary.
Yes,
Psychosocial. I did.
psychosocial
Yeah.
was a miss. Even though if it's not necessary, then you still have to address smoking, alcohol, sleep,
Yeah.
and
True. Yeah. Yeah. Mm.
diet and exercise. This is
Yeah. True. True.
important. Since
Mm.
he is having the first episode, but still we have to rule out in general diet. And his concern wasn't addressed properly. He wanted something like in 3 days, so and drips. So you can
Yeah.
just
Yeah.
tell him at the end that this condition can be managed at home. I'm giving you the medications, and if it
Manage at
doesn't
home. True.
resolve, yeah. So after that, I can admit you if you doesn't get better with this, or after that we
Mm.
can give you drips. Because sometimes the patient are very reluctant and they want admission. Here I didn't go in detail, but sometimes there is scenarios.
True. Well, this is very important point. You added that this is treatable at home. It is very important point.
Yeah. Yeah, and
Yeah.
one more thing that his colleagues is having the similar condition, so you could have advised like if your colleagues didn't, it's an extra point. If your colleagues didn't get any medications or they are suffering the similar condition, I advise you to tell them to visit a doctor, and they might need the similar prescription or likewise.
Y
And
yes, madam. Cipro is the right drug.
according to the local guidelines, yeah, we give this for the in
And also
Pakistan we
I
could
need to
give.
tell them, and I also need to tell them to wash your hands before and after taking
Yes,
food.
personal hygiene.
Make sure to make hygiene. This main thing I forgot.
In this every kind of acute diarrhea or viral or bacterial
Hygiene,
cases
hygiene.
where yeah personal hygiene is very important. Last case I forgot to tell Dr. Hafsa or Doctor, I forgot the name,
Dr.
sorry,
Fahim,
Dr. Aksa. Yeah, sorry, Dr.
Dr. Farheen.
Farheen, yeah, one concern, she wanted to cook for her home, her
Exactly.
family. So
Mm.
you have to
Yeah.
advise that please not to cook until and unless your symptoms are resolved, because this is
I
viral
see.
gastroenteritis
Uh-huh.
she got from
Not to
her
cook. Not
nephew.
to cook exactly
So
means then how she can manage?
yeah, sorry.
Means she should not cook until the diarrhea resolves,
Yeah,
right?
until the diarrhea is resolved. So in your case, Dr. Dilip, the patient was having bacterial gastroenteritis because he was having
Mm-hmm.
fever, although no blood, but he was having fever and 6 to 8 stools per day. And it was since last 4 days because he was on the trip 1 week back. And if you don't
Mm-hmm.
ask the patient, he won't tell you. He was on the trip 1 week back, you asked. and it is started within 24 hours of taking chicken, and it's been
Mm-hmm.
going on for now 4 days. Okay. So
Okay,
in
okay.
this condition,
Mm.
you did the right thing by prescribing the antibiotics here. Oral rehydration was given. Loperamide can be used if there is no blood and no high grade fever. Okay.
True,
No routine
true.
antibiotics if it is mild, but since he is concerned about his upcoming meeting, so we can still give him the antibiotic right here according to the local guidelines. Whenever you are getting
True.
confused between what to give and what not to give, according to the local guidelines. Like in my exam, there was a typhoid case and the patient, I have to prescribe the medication as I told according to the local guideline, that is a Zithro in Pakistan, a Zithro or Cefixime, here we prescribe. So I said according to the local guideline, I'm giving you this medication. So don't
So we
get
should not take
confused
the
when you
name
are
of the
prescribing.
medicines. We can only mention
We
that
we
local
should we
guidelines.
should no, 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 no. We should give the medication name there, but if you are getting confused, because typhoid regime is different everywhere, so in South Asia. So you can tell that
Mm.
according to the local guidelines, I'm giving you this medication, you have to take this amount and on this on daily basis.
Mm-hmm. True, true. And
Okay.
regarding the blood test, do I need to send the
Yeah, you have to.
full test like
Uh,
CBC, urine electrolyte, serum
yeah.
electrolytes like this? Mm.
Yes, here in the condition, but this patient was kind of stable, but since he was dehydrated and having fever, you can still send the stool culture because you will get Campylobacter or E. coli,
True.
anything like that. They will give you the report if there is any. But meanwhile, you will start the empiric antibiotic. You won't say that I will be waiting for the culture or to start the
Mm-hmm.
antibiotic. You will start right away, as you did.
True.
And safety
And madam,
netting,
mm.
if it's not getting better after antibiotics, they have to see or any blood in the stool or any high grade or constant
Ah,
fever.
true, true.
This safety netting has another marks. Yeah. So,
And
Dr.
madam,
Farin, you were asking about the bacterial food poisoning. This was one case. That's why I didn't explain you this before.
one
It's
question
clear?
means both
Yeah.
bacterial and viral should avoid cooking food or only viral.
Mostly viral is avoided, but in bacterial, we still have to tell about personal hand hygiene and all that. And
And
yeah,
and
when the patient
mm,
is in the cooking, like he is a cook, then still we have to avoid him
true.
for the viral, yeah, for the
Or
viral
he can
patient.
okay. And also, can we tell them that to wear gloves?
Uh, if they are having good hand hygiene and they should not cook until and unless the symptoms are resolved. And if the
Got it, madam.
patient is the cook, and
Mm-hmm.
we have to ask if the other colleagues that are having the similar symptoms, because
True.
sometimes they don't want to disclose it, and they tell you that I don't want my employee to get known by my disease. So we tell them I
Mm-hmm.
am activating the local public services that will be doing it without like anonymously.
Mm-hmm. And
They
madam,
won't
I
tag
said
his name, but they will
uh,
be
mhm.
checking the other people also. Yeah.
I also requested a bedside test of urine dipstick. Did I did right?
Urine dipstick, for what did you do? Urine dipstick?
The thing is that I want to that one second, to renal failure or just because dehydration.
Yeah, but he was passing normal urine like 3 to 4 times a day, so it
I see. So I
wasn't
should not
needed.
mention urine dipstick.
Yeah, not urine dipstick. Mostly we do it for the hypertension or diabetic cases, but not here required.
Diabetic, I see. Okay, okay. So it is not related here. In
But
UTI, we can also do.
yeah, UTI you can do for
UTI.
nitrates and leukocytes.
Okay, madam. Thank
Dr.
you very much.
Musara,
Thank you.
Dr. Musara,
Yes, doctor.
can you make it clear, like how we can differentiate between food poisoning and gastroenteritis, and how can we tell the patient?
Food poisoning and gastroenteritis, it's almost one and the same thing, but food poisoning mostly because of the food. And how will you tell the patient? It's mostly you took something from outside and it's a kind of bacteria, like he took chicken from outside. It
So
started
it
just
is
within
so food.
24
So you
hours.
mean food poisoning and gastroenteritis at the end? It is same thing.
Yes, because gastroenteritis is what again? Acute gastroenteritis, acute viral gastroenteritis, and acute bacterial gastroenteritis. The causes could be different. Virus can be found from like one case I did with you was acute viral gastroenteritis. She got it from the nephew, and mostly in the children, you got it from norovirus or rotavirus, but it's still a virus. You will give the symptomatic treatment. You won't label that you are suffering from norovirus, okay? And same
Mm-hmm.
likewise in acute bacterial gastroenteritis, there could be Campylobacter, E. coli, and things like that. Okay,
Mm-hmm.
so it
Mm-hmm.
is bacterial. Don't have to differentiate it is bacterial or viral. It is for us to differentiate because we have to start the antibiotic, not for the patient. For the patient, you just say that you are in, if it is infected, like its viral is also infected, and you are getting infected by the bacteria, so it's also infected.
Mm-hmm.
Okay.
Okay.
You have to tell the
Dr.
cause
Musarrat,
to the patient and you only the symptomatic treatment if it's acute viral and the antibiotic for bacteria. That's the difference. Yes.
Dr. Musarrat, I want to ask one question. If the patient is a cook or chef anywhere, so should we
Yes.
send a sick leave for him, like because he is dangerous for the others? Others can get the infection.
Yes, because here we cannot like this is very tricky topic. When we were studying for our OSCEs, it was always the like hotline
Mm-hmm,
how where we should tell the employer or not. Okay. So what we got,
mm-hmm,
we will ask the patient like he don't want the employer to know, but still we have to screen the other people there. So what we do, I am activating
mm-hmm,
the local health services or public services who will screen the other
mm-hmm.
people out there anonymously. Okay. So this is for the other co-workers who are working there or get or infected just to rule out if there is another one without letting know to the employer who is actually the the cause or this patient came to us anonymously. We have to do this. Here we don't break the confidentiality, but we do in a way that the patient is not affected, but everyone is screened. Am I making sense?
Dr. Musai, because
Sir, can you repeat it?
I heard one lecture of Dr. Imran. So because not of the colleagues, the other like the
Hmm.
customers who are coming to the restaurant, they also can get infected. So that's why I'm asking that. I think
Yes.
if I'm not wrong, that he said that we have to send him on sick leave, or we have to inform the, like, if I'm
I
not wrong.
told you have very detailed discussion about it. I don't know which lecture you're saying. We can still put it in the group and whoever gets the best answer. But what we got in our OSCE preparation is that sometimes we don't break the confidentiality here, but still it's necessary since we will tell the
Mm-hmm.
patient to take the sick leave. And if he's taking the sick leave and he doesn't want the employer to know, we will tell we are activating the local public health services will go there and screen anonymously. Okay, this was
Okay.
one point where everyone got agreed, but there is no like not anywhere it's written. If it's written, please bring it to us also because it was a very major topic of discussion. Still, if Dr.
Yeah.
Imran told it, we will ask him to repeat it. Okay, because it's
Yeah.
very
I'm not
technical topic. I cannot give just one
I'm
line
not
on this.
exactly memorizing that what he said, that, but this is a confusion in my mind, that should we like the confidentiality matters to us as a doctor, so we should not break the confidentiality, and also we
Yeah.
have to protect the other,
There
like you
are
said.
few things that we have to break the confidentiality, like HIV, okay, like other
Hmm.
STIs, because
Mm-hmm.
even the patient is telling you, no, don't tell my name or don't tell, we still have to, okay. There we do
Okay.
forcefully, and these kind of cases they are tested on confidentiality, not like acute
Hmm.
viral or gastroenteritis, because this is our own confusion. Still, usually when we tell
Mm-hmm.
the patient to take the sick leave, they usually take it if we write a letter, mostly people accept it. But if they are not accepting it in a way, they are not taking the sick leave or don't want the employer to get involved, we still tell them anonymously we have
Mm-hmm.
to screen the other employees. Okay? But
Got
this
got it.
kind of cases, I don't think that we got as far as I know in the exam. But this was a hot topic
Mhm.
of discussion. Still, I'm not sure we got the right answer or not. Okay? But you
But
handle
this is
your
the
way.
safe way.
I still
This
say
is the
you just
safe way.
handle your way.
You told the safe way to be a safe doctor.
Yeah, we have to be safe doctor. We still have to
Yeah.
screen our way. Okay, should we
Hmm.
close here
Okay.
or anyone wants to do another case? Or let's close here then.
Can I do a case?
Okay, Dr. Maida. Just give me a second then. Okay. So 70 years old, Mrs. Hamna came to discuss
Mm,
her problem with you. Please proceed with history exam management plan. Examination is great. Okay,
mm. Okay.
your time starts now.
Hi, good morning, Mrs. Amna. I'm Dr. Maida here. How can I help you today?
Doctor, I'm having this loose diarrhea, loose stool since few
Mm,
days now.
mm. Will you please tell me something more about your diarrhea?
Doctor, actually, it's been 3 to 4 days now. I'm having these
Mm,
watery stools. It's five to
mm.
seven times a day, and it's smelling so much offensive.
Okay. Miss Amna, is it okay if I ask you more questions?
Sure, doctor.
So, Miss Amna, this diarrhea started 3 days back. It started gradually or suddenly?
Doctor, it started gradually.
Gradually. And is it watery or semi-solid?
Sometimes watery, sometimes it's semi-solid.
Okay. And is it associated with some mucus and blood?
No, doctor.
Okay. And is it associated with nausea and vomiting?
Mm, no, doctor.
Okay. And uh, is it associated with the flatus? Or are you passing too much gases with this diarrhea as well?
Yes, doctor.
Okay. And how about abdominal pain?
Yes, doctor. I have uh, this mild lower tummy pain.
Okay. And this abdominal pain relieves after diarrhea or no?
No, doctor.
Okay.
It's
And how
very
many?
little, but it stays there.
Hmm. Okay. How many stools have you have been passing per day?
5 to 7 times a day.
5 to 7, quite a lot. Do you have any travel history recently?
No, doctor.
Okay. Is your diarrhea associated with some food intake?
No, doctor.
Okay. Are anything which makes it better, your pain better or diarrhea better? Anything you notice?
No, doctor, I don't notice. And doctor, I'm really feeling like I'm weak and washed out, and I'm not eating properly also.
Hello,
I feel dizzy sometimes. Hello?
hello.
Is Dr. Maida
Sorry, I was
here?
not able to hear you. Um, so anything which makes your condition better?
No, doctor, I feel like this all the time. I feel dizzy and I cannot eat properly also.
Okay. Are you, is it first time you have been facing this diarrhea or any past problem related to your stomach?
Doctor, on and off I get this, but I don't know why I'm getting it now.
Sorry,
It's
on
been
and off
one
you
week.
get this diarrhea?
No, doctor, on and not on and off.
Okay,
I recently got some infection, and my doctor started me on this antibiotic 10 days ago. I got
okay.
this lung infection,
Mm-hmm.
and yes, after completing
Lung
the course, I got this diarrhea.
diarrhea. Mm-hmm. May I know which antibiotic you have been taking?
Comoxiclav.
Okay. And are you still taking or you stopped it?
I stopped it, doctor.
Okay. And you took some medication to relieve this diarrhea?
No, doctor, just some juices I'm taking these days.
Hmm. Okay. Any recent history of hospitalization?
No, doctor.
Okay. And may I know that are you working somewhere?
No, doctor, I'm housewife.
Okay. So to whom are you living with?
I'm living with my husband and one son.
Okay. May I know that if you smoke?
No, doctor.
Okay. And any alcohol intake?
No, doctor.
Any recreational drugs?
No, doctor.
Okay. Miss Amna, I would like to summarize your case that you have been suffering from this diarrhea about 1 week, since 1 week off and on. You have been taking some antibiotics in the past due to lung infection. And after that antibiotic, you developed this diarrhea. You already have stopped the antibiotic. You have been passing about 5 stools per day. It's sometimes watery and semi-solid, sometimes semi-solid. It's associated with some abdominal pain, and you have come to check for this diarrhea. Am I right?
Yes, doctor.
Mrs. Amna, sorry, I forgot to know you. Ask you that is it something is concerning for you related to your condition?
Doctor, I just feel so much weak, and I'm really
Hmm.
maybe some bug is in my
Hmm.
stomach.
Mhm. Hmm. Okay. And what do you expect from me from today's consultation?
Some medications, doctor.
Okay. And is it bothering you some way?
Hello.
Is this condition bothering your life?
Yes, doctor. I just feel weak all the time.
Okay. Mrs. Amna, will you allow me to do a quick examination for you?
Sure, doctor.
Okay. I will check your pulse, BP, and temperature, and I will also check your hands and for any changes, anemia and jaundice. I will check. I will ask you to open your mouth. I will want to check your dehydration. I will take. I will check the state of dehydration from your skin as well. I will ask you to expose your abdomen so I can do as inspection and gentle, superficial and deep palpation. I will also request you to do a PR examination. So please, if any positive finding, please let me know.
Okay. She looks unwell, and mild tachycardia, low-grade fever, abdomen mild, diffuse tenderness, no guarding, bowel sounds present,
Mm-hmm.
moderate dehydration, like dry mucous membrane and reduced skin turgor.
Hmm. Okay, Mrs. Amna, based upon your history and examination, looks like that you have been suffering from acute diarrhea, which is mostly looks like associated with your antibiotic. I will send a few investigation to confirm that, but so far I think it's due to a bacteria which is called Clostridium difficile infection. Do you have any idea about this infection?
No, doctor.
Okay. I will explain you. Actually, when we are using some antibiotics, sometimes what happens there, the side effects of some antibiotics is that our gut become infected with a bacteria which is called Clostridium difficile, which causes acute diarrhea. And but it can be treated with some antibiotics like vancomycin. But to confirm, I will send your CBC and stool culture for further
Mm-hmm.
confirmation. But meantime, I will start you antibiotic, and I will give you some advices to manage your diarrhea at home. In case you won't be able to handle it at home, you will feel very lethargic, dehydrated, drowsy, irritable, or you will feel muscle cramps, or if you will feel that your urine output is less than normal, you have to immediately report to us in emergency. Meantime, I am writing this antibiotics vancomycin 125 milligram 6 hourly for 10 days. And
Okay,
I will
doctor.
advise you to have soft diet at home, like banana, rice, and some porridge. You can gradually increase your diet once your diarrhea will settle. And also, I will advise you some hand hygiene and food hygiene, and continue soft diet for some time. And I will advise you to keep this antibiotic. Don't take this antibiotic anymore. And if you still have chest infection, you can go and visit your chest specialist to recheck, and maybe he will advise you some other antibiotic instead of this antibiotic. Am I right?
Okay, time's up. Okay. Okay, Dr. Maida. So she was an old age woman treated for pneumonia with broad spectrum antibiotics. Most likely she is suffering
Mm,
from C. difficile that you told. Urgent stool sample for C. difficile toxin and culture should be done with CBC, urea electrolytes, CRP to assess the severity and dehydration level.
mhm,
Also, always ask here she was having 5 to 6 stools per day, and if
mm,
it's more than 4 stools, then we start the antibiotics. So you did start the antibiotic, but still we will tell that I still need to see your reports, but I'm starting you on the
mm,
antibiotics. And sometimes this is not like straightforward case. Sometimes they also give you the investigation on the table when you tell that I have
mm,
to do this. And right after that, you can start the antibiotics. Assess clinical
mm, mhm,
severity. If significant systemic illness or severe dehydration, then you have to refer to the hospital. Otherwise, you can manage it at home since
mm,
he has a caregiver. If she is not having a caregiver, then you have to admit the
mm,
patient. If
mm,
stable and
mhm,
local pathways allow, stop precipitating the antibiotics. Like in our local pathways, like even when we studied in AKT, not everywhere vancomycin is not everywhere available. So sometimes we also give the
mm,
second line metronidazole.
mm, mhm,
Okay, so first line is Menco and the orphan
mm,
pyridoxamycin, and sometimes it's also given as metronidazole, if I'm not wrong.
mhm.
Pakistan, it is
Yes.
not available. Dr. Musarat, you are right.
Yeah,
Vancomycin is not
yeah,
available.
yes, yes. And strict hygiene advice, especially if she's in care home. She's 70, might be someone else taking care of her. So we have to
Mm,
tell
mhm,
her and the caregiver about the
mm,
strict hand hygiene. Okay, otherwise,
mm, mm.
you asked most of the things, but one thing, did you ask about the recent travel and the similar
Yes.
illness in family? Okay,
No, I forgot about family history.
yeah, family history. And otherwise, you ask about psychosocial, and sometimes in older patient, and usually with this acute condition, we have to rule out about the sleep disturbances, sleep, diet, exercise.
Mm, mm, mhm. In this case, because there was clear-cut history of antibiotic-related diarrhea, still
Yes,
contact and family history is important.
yes. Everything is
Hmm.
important because we don't know what is the hidden agenda, even though this is a straightforward case, but there could be previous history of the similar condition. But still, in OSCE, we
Hmm.
still have to ask past medical, family history, drug history, very important, allergies, psychosocial, everything, because everything contains mark.
Hmm. Hmm.
Idea, concern, expectation, and
Hmm.
impact. Okay, and summary itself
Hmm.
holds
Hmm.
almost, I don't know how much, but there was one, someone told that if you don't ask the summary, it's a negative, it's pitfall. You will get negative marking.
Hmm. Hmm.
Okay, so till now, I guess we
Hmm.
discussed
Hmm. Yes.
bacterial, viral, C. difficile, and hemorrhoids and anal fissure, all of that. If there
Dr.
is any
Musarraf,
query or any, yeah,
how can I explain to the patient about Clostridium difficile? Can you explain me in a simple way?
simply we will just tell the patient this is most likely your bowels got irritated because of the long-term antibiotics you took for your lung infection. That's it. Sometimes we don't have to go into detail like it's inflammation or just your bowels are reacting to the long-term antibiotics and we it is a treatable and manageable condition. I am giving you antibiotics for this, this, and this. It's as simple.
Dr. Musarat, can this case, the C. difficile, come with PPIs, like the scenario? Because PPIs are also a risk for C. difficile.
PPA is a risk
Yeah,
factor for C. difficile.
Yes, PPI
yeah.
also is a
I
risk
PPI is
don't
factor.
know,
also,
but
Prolonged history.
always with the broad spectrum they give.
okay, but like in exam, this
Okay.
scenario is
Always the
like no.
antibiotic associated PPI is not an antibiotic, so I'm not sure. Maybe there is, but it's antibiotic associated, so it's always C. difficile.
Yeah, but I'm just asking that in exam, always antibiotic associated comes, not like PPI, because PPI is a
Yes,
risk.
PPI might like derange the condition even more, but I don't think so. PPI is the cause of C. difficile. C. difficile is basically from the broad spectrum antibiotics.
It was in past medicine, it is the second one. One is the broad spectrum antibiotic, and the second one is
Uh,
PPI, long-term
yeah,
usage
it
of
could be,
PPIs.
but in OSCE there is always the common condition like antibiotic associated. So PPI
Oh,
has other
okay,
risk factors. They will bring PPI in other cases, not in this.
okay,
They never
Dr.
brought
Musarraf,
actually.
I have
Okay.
checked what we were discussing in previous case, how when to inform the health protection agencies. So whenever
Yes,
you are
yes, yes, please.
suspecting food poisoning, whether in an office setting or you see people coming from a typical restaurant, first of all, you have to do
Mm.
stool for microscopic culture and sensitivity. And if any bug comes out in culture and sensitivity, then you have to inform health protection agency. Before
Yes,
the microscope, you cannot tell them. You cannot involve the HPA.
that's a good point.
Yeah.
Thank you for adding. And even
Yes,
though we cannot wait for the cultures to start the antibiotics, we still have to
yes,
give the
yes.
patient.
We have to
This is
start the
the one
antibiotic as
important thing
per
we should
local
know.
guidelines. Yes,
Yeah.
yes,
The culture report is for the others' protection or others'
yes,
awareness, but right now the patient is the priority. We have to start the management.
yes,
Yes,
exactly.
thank you,
Okay,
Dr. Amisa. Thank you for clearing.
welcome. Okay.
But still, it's not clear if the patient gives you the report of the culture, then he doesn't want the employer to get involved. Then what will we say? It's again
yeah.
the same.
This is the thing which should be clarified.
This
It
is
is the
very
absolutely
difficult.
responsibility of the doctor that if you are suspecting food poisoning and you have the report of microscopic culture and sensitivity, even if the patient does not want, you have to inform the health protection agency. In any case, you have to inform if it is a case of food poisoning and it is confirmed with
Yeah.
report. Yes,
It's health protecting agency. That's what I was saying. That local health agencies we have to tell. Even the patient is asking or not asking, we still have
yes,
to allowing or not allowing, we still have to involve health
That that
protection
Dr. Musarraf
services.
already mentioned what we are confused in,
Yeah.
that we should involve the employee, like we should
No employee. Employee is not required to be involved by you. The health protection agency will contact the employer himself themselves.
Yeah,
As a
yeah,
business,
that's
you
what
are
the
just required
anonymous
to
case we were
inform the
doing.
HPA, just the HPA. For the employer, he can
Hmm.
just write a note for giving sick leave to the patient if he requires it. But we have to inform the HPA. They will investigate the case, not us.
Yes.
okay, so we should not
Okay,
break the
doctors.
confidentiality.
Okay, anonymously we will do break the confidentiality, but in after we get the MNCs and we will involve the health protection services. It's up to them then. Okay, we will get the report and we
Hmm.
will involve them.
Okay, thank you so much, Dr. Musarraf.
Okay. Uh, thank you everyone. I hope it was a good session. In Ramadan, everyone must be sleepy right now. Take care
Yeah.
and okay,
Thank you very much.
everyone.
Thank you,
Thank
Dr.
you.
And
Musarraf. Thank
see you
you. Thank you
tomorrow.
very much.
Thank you, everyone.
Thank
Tomorrow, it's morning time. I guess Dr. Imran will reconfirm it in a while, or he already did.
He already
Tomorrow
did.
is the revision of GRT. Yeah. So tomorrow is revision. Please, everyone, be there. And if we have any queries, we can ask there. Okay. Thank you, everyone.
Okay, thank
Good
you so
night.
much. Allah Hafiz.
Allah Hafiz.